Did you know that stomach cancer, also known as gastric cancer, is one of the most common and deadly cancers worldwide? Yet its early symptoms are often ignored because they seem so minor. In this video, we'll uncover 8 strange signs of stomach cancer that most people overlook. Signs that could save your life or the life of someone you love. We'll explore each of these unusual symptoms, explain why they happen, and back them up with research from trusted sources like the American Cancer Society and the World Health Organization, WHO. Whether it's unexpected bloating or persistent fatigue, we'll show you what these symptoms really mean and when you should take them seriously. But that's not all. This video is about empowering you with practical knowledge to take charge of your health. Early detection of gastric cancer can significantly improve survival rates, so understanding these subtle clues is critical. Before we dive in, we have a small favor to ask. If you find this information helpful, please like this video, share it with others, and subscribe to our channel for more health awareness content. Your support helps us bring life-changing information to more people. So, are you ready to uncover the 8 strange signs of stomach cancer that could make all the difference? Stick around to the end, as we'll also discuss when to seek medical advice and share tips on staying proactive with your health. Now let's dive into the first 2 symptoms, and you'll see how easily they can be mistaken for something minor. But ignoring them could be dangerous. The first signs of stomach cancer often hide in plain sight, blending in with symptoms of everyday digestive issues. One of the earliest and most commonly overlooked signs is persistent indigestion and heartburn. While occasional acid reflux after a heavy meal is normal, chronic indigestion that doesn't improve with over-the-counter remedies is not. This condition, medically known as dyspepsia, can occur because of disruptions in the stomach lining caused by a growing tumor. The American Cancer Society reports that many people dismiss this as ordinary reflux or attribute it to stress or diet, which delays diagnosis. Imagine enduring a constant burning sensation in your chest and stomach, especially after meals despite cutting back on spicy or acidic foods. This discomfort might not seem alarming at first, but when it lingers for weeks or even months, it's a signal to consult a healthcare professional. Another subtle yet significant sign is unusual bloating after meals. Many people experience bloating from time to time, often linked to overeating or certain foods. However, when even small portions of food leave you feeling excessively full or painfully bloated, it could indicate a blockage caused by a tumor. This abnormal bloating often occurs because the stomach struggles to empty properly, leading to trapped gas and discomfort. The Mayo Clinic emphasizes that when bloating becomes chronic and is accompanied by other symptoms, such as nausea or mild stomach cramps, it may point to a serious underlying issue. Picture this. You finish a modest meal, yet your stomach feels as though you've devoured a feast, leaving you uncomfortably distended and fatigued. This isn't just an inconvenience, it's a warning sign that should not be ignored. Both of these symptoms, persistent indigestion and abnormal bloating, are often dismissed as minor issues, yet they could signal the beginning of something more serious. The key is to notice when these symptoms become patterns rather than isolated incidents. If they persist despite lifestyle changes or medications, it's essential to seek medical advice. Many healthcare providers recommend diagnostic tools like endoscopy or imaging tests to determine the cause of these ongoing digestive issues. By staying vigilant about these signs, you can catch potential problems early, increasing the chances of effective treatment. As we move forward, we'll explore 2 additional symptoms of stomach cancer, which shift from digestive discomfort to physical changes that might surprise you. Stay with us. It could be life-saving. While digestive issues often mark the early stages of stomach cancer, the body also signals distress through more noticeable physical changes, such as unexplained weight loss and chronic nausea or vomiting. Unintentional weight loss is one of the most alarming signs because it is often drastic and happens without any changes to diet or physical activity. According to the National Cancer Institute, losing 5% or more of your body weight within 6 to 12 months without effort is a significant red flag. A growing tumor in the stomach disrupts the body's metabolism and nutrient absorption, causing weight to drop rapidly. Furthermore, many people with stomach cancer experience a reduction in appetite due to constant discomfort in the stomach region, further contributing to their unexplained weight loss. Imagine trying to enjoy your favorite meals, but each bite feels like a burden, leaving you uninterested in food entirely. This change might seem minor initially, but it's critical to pay attention when the weight keeps dropping for no apparent reason. Another troubling sign is chronic nausea or recurring episodes of vomiting, often dismissed as a stomach bug or stress. While occasional nausea is common and usually harmless, persistent nausea over several weeks can indicate that something more serious is happening in your digestive system. A tumor in the stomach lining can irritate the tissues, triggering consistent nausea that refuses to subside. Sometimes this symptom escalates to vomiting, which may be forceful or frequent, further worsening the body's state by leading to dehydration and electrolyte imbalances. Particularly concerning is when the vomit contains traces of blood or resembles dark coffee grounds, a clear indication of internal bleeding. The World Health Organization, WHO, urges that recurring vomiting, especially when it involves blood or occurs alongside other symptoms like pain or weight loss, requires immediate medical attention. These signs often occur in combination, making them even more concerning. For example, persistent nausea paired with weight loss paints a clearer picture of the body's struggle with an underlying issue. The American Cancer Society explains that when stomach cancer is involved, the early symptoms often mimic more benign conditions, delaying diagnosis and, unfortunately, treatment. It's crucial not to ignore the warning signs your body provides. Medical evaluations, including blood work, imaging scans, and endoscopic procedures, can uncover the root cause of these persistent issues, helping to rule out or confirm cancer as a possibility. Now imagine dealing with constant nausea, an inability to eat comfortably, and unexplained weight loss while trying to maintain your daily routines. Many people dismiss these symptoms as stress-related or dietary, hoping they'll go away on their own. Unfortunately, the delay in seeking medical advice often allows the condition to progress unchecked. By being proactive and vigilant about these signs, you can ensure early intervention and potentially life-saving treatment. Now we'll uncover 3 more strange signs of stomach cancer, each focusing on gastrointestinal warnings and physical discomfort that often go unnoticed. These symptoms might seem unrelated, but together they form a crucial puzzle that could save lives if addressed early. Stay tuned. In addition to the previously discussed signs, stomach cancer often reveals itself through other gastrointestinal and physical symptoms that are easy to overlook but crucial to recognize. One such sign is feeling full quickly, also known as early satiety. This symptom occurs when even small meals leave you feeling completely stuffed, to the point where you can barely take another bite. While occasional fullness is normal, consistent early satiety can signal a more serious issue. A growing tumor can physically reduce the stomach's capacity or interfere with its ability to expand and accommodate food, making you feel full prematurely. Over time, this leads to poor nutrition and unintended weight loss. Imagine sitting down for a light snack, only to feel as though you've just eaten a 3-course meal. This persistent feeling of fullness, even after minimal food intake, is a red flag that should not be ignored, particularly when it occurs alongside other symptoms like nausea or weight loss. Medical professionals often recommend diagnostic tests, such as an endoscopy, to identify the underlying cause of this troubling symptom. Another alarming sign is the presence of blood in stool or black tarry stools, medically known as melena. This symptom often goes unnoticed because many people don't regularly inspect their stool, or they attribute changes in stool color to diet or harmless conditions like hemorrhoids. However, blood in the stool is never normal and could indicate internal bleeding caused by a stomach tumor. Bright red blood typically signifies bleeding lower in the gastrointestinal tract, while dark tarry stools suggest that the bleeding is occurring higher up, such as in the stomach. This happens when a tumor erodes into nearby blood vessels, causing slow but consistent bleeding. The American Cancer Society highlights that even a small amount of blood in the stool can be a sign of cancer and should prompt immediate medical evaluation. While certain foods, like beets or iron supplements, can temporarily darken stool, the key difference is consistency. Melena often persists, and its tarry texture and foul odor are unmistakable. Another commonly overlooked symptom is persistent stomach pain or discomfort. This pain often starts as a dull ache in the upper abdomen and may come and go in the early stages. Over time, it can become more localized and severe, particularly as the tumor grows and places pressure on nearby organs. Many people mistake this discomfort for ulcers, gas, or indigestion, leading them to self-treat with antacids or home remedies. Unfortunately, these methods provide only temporary relief, if any, and the underlying issue remains unresolved. Persistent pain that worsens over time, especially if it's accompanied by other symptoms like nausea, vomiting, or changes in stool, should be taken seriously. The Mayo Clinic advises that any abdominal pain lasting longer than 2 weeks should be evaluated by a healthcare provider, as early detection of serious conditions like stomach cancer can significantly improve outcomes. Together, these three signs, early satiety, blood in stool, and persistent stomach pain, form a concerning pattern that demands attention. Individually, they might seem harmless or easily explained by common conditions like indigestion or diet changes. However, when they occur together or persist over time, they become strong indicators of a potential underlying issue. It's important to remember that early symptoms of stomach cancer often mimic less serious ailments, making it easy to dismiss them. This is why awareness is critical. Recognizing these subtle yet persistent changes in your body can help you seek medical advice sooner, potentially catching the disease at a stage when it's more treatable. Imagine dealing with these symptoms daily, struggling with a constant sense of fullness, noticing dark stool, and enduring lingering stomach pain. These might seem like minor inconveniences at first, but they could be your body's way of signaling that something is wrong. It's easy to hope they'll go away on their own, but ignoring them could allow a serious condition to progress unchecked. If you or someone you know experiences these signs, don't wait for them to worsen. Consult a healthcare provider who can perform tests like imaging scans, blood tests, or endoscopy to determine the cause and provide appropriate treatment. Now we'll uncover the eighth and final symptom of stomach cancer and discuss when it's time to seek medical attention. We'll also share tips for staying proactive with your health and understanding how to take these signs seriously before it's too late. Stay with us. It could make all the difference. The final and often overlooked sign of stomach cancer is persistent fatigue and anemia. While everyone experiences tiredness at some point, chronic fatigue that doesn't improve with rest and is accompanied by other symptoms, such as weakness or shortness of breath, could indicate an underlying problem. In stomach cancer, fatigue is often linked to anemia, a condition where your body doesn't have enough healthy red blood cells to carry oxygen efficiently. This anemia is commonly caused by slow, internal bleeding from a tumor in the stomach lining. Over time, this blood loss depletes the body's iron levels, leaving you feeling drained, lightheaded, and unable to perform even simple daily tasks. The National Cancer Institute emphasizes that persistent anemia, especially when it's unexplained or resistant to treatment, should prompt further investigation for underlying causes, including gastrointestinal cancers. Imagine struggling to climb a flight of stairs you once breezed through, or feeling exhausted after a short walk. This type of fatigue isn't just a sign of a busy schedule. It's your body signaling a deeper issue. If these symptoms, or any of the previously discussed signs, persist for more than a few weeks, it's time to consult a healthcare professional. Recognizing when to seek help is critical in catching stomach cancer early, when treatments are most effective. Start by noting how long your symptoms have lasted and whether they've worsened over time. If you're experiencing a combination of symptoms, like unexplained weight loss, persistent nausea, early satiety, or blood in your stool, these patterns can provide crucial information to your doctor. Diagnostic tests such as endoscopies, biopsies, and imaging scans can help identify whether a tumor is present and how advanced the condition might be. According to the American Cancer Society, early detection of stomach cancer significantly improves survival rates, with many cases being curable if caught in the initial stages. Apart from knowing when to seek help, it's equally important to take proactive steps to lower your risk of stomach cancer. A healthy diet plays a key role in prevention. Focus on including plenty of fruits, vegetables, and whole grains while minimizing your intake of processed meats, smoked foods, and excessive salt, as these are known risk factors for gastric cancers. Additionally, lifestyle habits like limiting alcohol consumption and avoiding tobacco products can help protect your stomach lining from damage. The World Health Organization, WHO, also highlights the importance of regular checkups, particularly for individuals with a family history of stomach cancer or other risk factors, such as Helicobacter pylori infection. Staying informed and proactive about your health can make a significant difference in early detection and prevention. As we conclude this video, let's recap the 8 strange signs of stomach cancer that we've covered. Persistent indigestion and heartburn, unusual bloating after meals, unexplained weight loss, chronic nausea or vomiting, feeling full quickly, early satiety, blood in stool or black, tarry stools, persistent stomach pain, and fatigue or anemia. These symptoms, while subtle on their own, become far more concerning when they appear together or persist over time. Remember, stomach cancer often begins silently, mimicking everyday ailments, which is why awareness is key. Early recognition of these signs can lead to timely medical intervention and potentially life-saving treatment. Finally, a small but important request. If you found this video informative, please take a moment to like, share, and subscribe to our channel. Your support helps us reach more people with critical health information that could save lives. Also, share this video with loved ones who may benefit from this knowledge. Awareness is the first step toward prevention and early detection, and by sharing this message, you're playing a vital role in spreading it. Thank you for staying with us until the end of this important discussion. We hope you now feel more informed and empowered to take charge of your health. If you've noticed any of these symptoms in yourself or someone you care about, don't hesitate to seek medical advice. Early action is crucial in fighting stomach cancer and improving outcomes. Stay proactive, stay healthy, and we'll see you in the next video, where we'll continue exploring topics that matter to your well-being.